Okay, so I connected the electrodes to the EKG machine and I waited for that tracing to come up, which is pretty much the best that you can get, which is the QRS complex. And as you can see there, the QRS complexes that I'm getting in those leads are evenly spaced. So that means that my heart rhythm is regular, which is pretty good. So, I mean, when you have an arrhythmia, the heart can beat at different times, and that's not good because the organs, they always suspect their blood perfusion or their blood supply at a regular time. It's like a paycheck. It's better to have paycheck every week or every 2 weeks or every month, but a regular basis than having one paycheck one day and possibly get one in the next 3 months and possibly one the day after. So certainty is very important as well in physiology. So as you can see, that's the best that you can get. If you see some wiggly lines in the EKG in this type of experiments in the lab, it's because we are not using all the leads. We are only using the arm and the leg leads, and then you need the precordial leads to have the perfect EKG. But this is just to demonstrate that the heart have electrical activity that you can record in a machine like this. Now, once you have that, you can press the start button, and then you can have the actual recording of the activity of the heart. You can see there, and at some point this machine is going to give you some interpretation of the results, and most of the machines do. Okay, the ones that they use at the hospital, they tell you, okay, this is the number of heartbeats per minute, this is the rhythm, etc. And they can tell you potential diagnosis. Now, we are not diagnosing anyone. We're just showing how these EKGs are done. And when you put these electrodes, one thing that you have to make sure is that they are always well connected into your body. Otherwise, you will have trouble, as I had before, making this recording. And like I said, you don't trust this interpretation of this machine because we are not a diagnostic lab. Okay, so this is just an academic lab. So that's all for EKG.